Now I'm going to go through a demonstration of removing and replacing of the G-tube. For demonstration purposes, this child will have a low profile button in that I will remove and then replace with another low profile button. The first thing that we recommend doing is having yourself set up. That way when you're ready to do the change, it's kind of a 1, 2, 3, you're all set to go. So here are all the materials that come from the G-tube kit all set out on the table. The first step I'm going to do is take a look at the G-tube and see the amount of water I need, which will be on the bottom of the G-tube under BAL, which stands for balloon. So here it tells me I need 4 mLs, which stands for milliliters. So I will use the slip tip syringe and will draw up the 4 mLs of water. I'm going to insert this into the balloon port, which has a blue spring valve. And I'm going to just gently apply a little pressure when I place it in. And as I insert the water, I'm going to look at the balloon to make sure that the balloon is inflating and it's not leaking. Take note that I'm holding pressure on this plunger as I place the water in, as this valve has a spring to it and will kick back that water into the syringe as it deflates the balloon. It's important to note that when you check the water in the balloon, you not only place all of the water in to make sure it fully inflates, but to also make sure that that syringe comes back to that desired amount to make sure all of the water is out. You'll notice on my setup that I also have an extra slip tip syringe that's empty. And the reason that is there is we often recommend that you have an extra one to take the water out of the balloon of the G-tube that's already in the child. That way you have one ready, you can remove the water and have one ready with new water to place into the balloon that you're going to replace with. The next step is to take your stylet and you're going to insert it into the center of the G-tube. And what this does is it provides a little bit of rigidity. So that way this flexible, mobile G-tube has a little bit more firmness to it. So when you insert it, it can go straight down. Some find it easier to have your pre-filled syringe with your water already connected to that balloon port, sitting and waiting, ready to go. Some parents prefer not to do this, and some have said that it's been a lot easier when placing the G-tube. So this is really something that you'll find with a little bit of time and practice, what you feel most comfortable with. The next step is to place the water-soluble lubricating jelly. It's important that you use the packet that comes in the kit, as using something like Vaseline can actually cause breakdown of the G-tube. So you will open it and place the jelly on the base of the G-tube. We recommend having all your supplies ready and available right here next to your child, so that way you can remove and replace quickly. Now that your supplies are set and ready, your child has a G-tube that is in place that needs to be removed prior to the insertion of the new G-tube. So that is where this extra slip tip syringe is going to come in handy. With gentle pressure, I'm going to insert it into the balloon port, and you'll notice that there is that spring-loaded action of the water filling back into the syringe. Once it seems like the syringe has all of the water in it, give another gentle pull back on that plunger to make sure all of the water is out. Now I'm ready to remove this G-tube and replace with the new one. You will pull up gently on a straight angle to remove the G-tube button. Pick up your new button, and with that same straight, gentle pressure, push straight down. Once you're in place, gentle pressure on that syringe plunger to push all of the water into the balloon, holding pressure on that plunger as you remove it from the balloon port to make sure the water doesn't come back out. You will then remove the stylet from the center, and now your G-tube is secured in place. The next step is to confirm placement to make sure it's in the right track. So in order to do that, we will use the extension set that came in the kit and the catheter tip syringe. So you want to make sure that the smaller feeding port is closed prior to checking placement. And then you will take the catheter tip syringe and insert into the larger feeding port. You will then connect your extension and give a gentle pullback on the plunger of the syringe. It should draw some stomach content or food that may be in the child's stomach into the extension to confirm that you have placed it in the correct spot. Once you have done that, you can remove your extension, close the flap of the G-tube, and wipe off any excess lubricating jelly. Now I'm going to demonstrate how to connect and disconnect the extension from the G-tube. On your extension will be a black line that you will line up with the black line on the G-tube button. You want to place your fingers on the sides of the G-tube while you line up those two black lines and apply gentle pressure to push down and engage the locking mechanism. You will then give a 3/4 turn in order to lock the extension into place until it can go no further. To remove the extension, you will do that 3/4 turn back to line up the two black lines. Again, placing your fingers on the sides of the G-tube, gentle pressure to pull upward to release the G-tube extension. When checking the water in the balloon, it is really important to have all your supplies ready. We usually recommend doing this if the G-tube appears that it is loose or it is leaking. It is also helpful to have either another individual or an item to help distract your child while you're checking the water in the balloon. That way you can have your undivided attention to the G-tube to make sure it remains secured. You will use that slip-tip syringe that you had initially to place the water into the balloon. With gentle pressure, apply it to the balloon port. Often you will see that water will spring back into the syringe, but if not, give a gentle pull on that plunger to allow the water to come back into the syringe. Now I can see on this G-tube, the balloon volume on the button itself is telling me there should be 4 milliliters of water. In my syringe, there is currently only 2. So the fact that this button has appeared loose and there's less water in the balloon tells me that I need to refill that. What I will do is remove this water and discard it, and I will fill the syringe with new 4 mLs of water. Insert the water with continual pressure on the plunger of the syringe to make sure the water does not come back into the syringe, and confirm that the fit is more snug after refilling the balloon with the appropriate amount of water. After your child has had a surgically placed gastrostomy tube, the first change of that G-tube will be done in our outpatient surgical office. This first change is always done by one of our nurse practitioners. After that first change is done, parents, caregivers, or nurses are able to perform routine changes at home. If there's ever an issue of feeling hesitant, reluctant, or concerned about performing these changes at home, we are more than happy to have you schedule a nurse visit for G-tube changes in our office.